do have overall, I have a weekly report that I use to do the graphs, the charts or graphs. So overall, 51% of our deaths since the beginning of the pandemic have been 75 plus. 22% have been in the 65 to 74 year range, and then 22% have been 50 to 64. So obviously it's skewing that well over 82, 80, probably 84% are over 50. But, obviously we see some outliers of people that are much younger that are passing away from COVID as well. We're just continuing to see, it's at a high number of outbreaks in our long-term care centers, both in the residents, but especially in the staff. So it's high. I believe last week we were at 38 outbreaks. The week before we were at 37. I don't have this week's numbers in front of me. What we're seeing out in the community, whether it's any workplace where there's a lot of individuals that have COVID. We've been working with our nursing homes since March of 2020, providing them education and tools for prevention, going in there, helping with our partners, offer vaccines. So it's, we've been doing all the right things. It's just a matter of, it's so much in the community, so many cases in the community. It's just sad fact that you'll have cases in the nursing homes. Well, I think, when you look at our daily numbers, how they're coming down, I believe we have probably, if we can get through this month of February, as we move into March, we're going to see our cases, like you said, leveling out at a lower level, and we'll be in a good spot. It's just a matter. So, I am encouraged by the numbers coming down. It is sad to see, like I said, the deaths go up. And, those are 711 families that have been affected. But trying to keep that into perspective. And as we move forward, I hope to see cases continue to decrease, hope to see deaths decrease. And I think it's just a matter of us staying diligent over these next few weeks as we get out of the colder weather into spring. That will be in a much better place.